Hi everyone, today I'm taking a break from our regular travel videos in order to make, like I promised, this video with an 8-month update. After my hair transplant surgery, 8 months have already passed since I've been in Istanbul. And we have made 2 videos about that. One with procedure in Istanbul and another 6 months update. Please feel free to watch those videos first because today I won't discuss again the topics we've discussed in those 2 videos. You can see that's how my hairline is looking today after 8 months. And for getting also an opinion of a professional, we'll try to reach on Skype a little bit later on Dr. Firdavs Ahmedov, the surgeon who did my transplant 8 years ago in Istanbul. But for now, I will catch up with the news, which are not very many. Yeah, the hair grew farther. I kept using the vitamins and the minerals and minoxidil spray. I also avoided using finasteride for the reasons I've explained. The minoxidil spray I've used occasionally. Unfortunately, I have not the patience to use it on a daily basis because it's very difficult now that I have long hair to use it on the skin. So you need quite a lot of it and a lot of time in order to get to the roots of the hair, which is not good. Minoxidil is intended to be used not necessarily for the transplanted hair, but for the old hair in order to stop an possible progress of the old baldness line. Of course, in the last months, I didn't experience any more pain. Again, I've had a little bit of itching, occasional itchings in the donor area during the first 4 or 5 months after the surgery. And the transplanted area was a little bit numb. Even 6 months after the procedure, I couldn't feel like before the transplant. Now it recovered, and I can definitely feel if you would stitch me with a needle in my forehead, I will definitely experience the pain. A very important thing I understood in the last weeks was that it's crucial how you sell your new hair. So basically, if I would shave my head, you might be able to tell there's a difference between the transplanted area and the original hair. Of course, the transplanted area cannot have so thick hair like the original hair of your head. But if the transplant was made clever enough, you can get a haircut which advantages you, which can make you make the most of the new hair. And that's exactly what I'm doing. If you can see, the hairline is quite farther up, but I am putting my hair down to my forehead, so it looks like I would have I would possess more than I actually am. I on purpose didn't use any hair conditioning or hair gel right now because I wanted you to see my hair exactly how it is. So nothing fake. It's just the hair I have now. Yes, and I dye it. I used to dye it, so you can see it's not affected by the color. It's quite a healthy hair, and it looks the same all over the head. So from that point of view, I'm very satisfied, and that's why I suggest you, if you want to do this, look for a good clinic, because it's very important what they are doing with your hair. I went to Smile Hair Clinic by accident, let's put it that way. I was looking for a mid for a mid-range price clinic, and I stumbled upon the Smile Hair Clinic. I liked very much the name. I read a lot of reviews about this clinic, and now I'm very satisfied with the result. So also a good clinic is crucial for maintaining a contact with the doctors after the procedure in order to get opinion on how your hair is recovering, what shall you do, and so on and so forth. And that's one of the reasons I will try to contact now Dr. Firdavs Ahmedov from Smile Hair Clinic on Skype in order to do my 8-month consult. So hello again, Dr. Ahmedov, how are you?
So far, so good, Adrian. It's good to see you again, and I'm seeing more and more improvement and change in your hairstyling. Actually, becoming more natural and maturated. Actually.
Okay, so now you can do your do your thing and watch closely my new hairline, which, by
Yep.
the way, you transplanted.
Yeah. It
um,
looks natural actually, like the
yeah.
regular receding line with the natural macro and micro irregularities. So far, so good. And you have a good hairdresser. He made a nice haircut for you.
What do you think after 8 months? At the time of the surgery, you told me I have to wait like 18 months until I will get like 90% of the hair coming out.
Okay, here is the point. Actually, it goes a little bit different. The time frame goes like the initial results around 30 up to 50% of the results around 6 months. We call it the first results. Good results will take up to 1 year. It's around 80 to 85% of the results, and final results may take up to 18 months. So basically, the front line or the front side maturates really early. It's around 1 year. It's perfect enough to full maturation to front line. But the final maturation, up to 18 or even 24 months, is specifically mentioned about the crown area. The crown area is the area that maturates the latest one. Okay, that's why we have that time frame. There are general rules we follow up, but of course it doesn't mean for everyone it applies the same way. But we know for sure that almost up to 80, 85, even 90% of the results are done by 1 year. It's for the front side. So 1 year is the time when we can say yes, we succeed in surgery or we failed the surgery, or it's like an intermediate result and may need the improvement in the future. Okay, so 1 year is a cut-off point for us saying yes, it worked. But we are talking about the front side. For the crown area, it's better to wait for up to 18 minutes because it's a little bit slightly different compared to the front side or the mid scalp of the head.
It's very strange what you were saying because I'm very happy even after 8 months.
Yeah.
Even if it stays like this, I'm quite satisfied, I must admit.
Yeah, here is the point. Actually, these are the general time frames related to the total number of the patients that were evaluated and taken under the follow-up controls. Of course, for some patients, the good results we may see even earlier at around 6 months, 7 months. It's very, very individual. These are the average time frames, but it can be very individual. In some patients, it can go really weak up to 6 to 7 months. Then it just accelerates and catches up the good dance of the 12 months. Every once in a while, we call them delayed births, and there are also early births like you, whose hairline or the hair matures pretty early.
So you think after another 4 months there will be a much different result?
Not the much different results, but I would say how the hair actually grows. When the hair first grows, it always grows like a tree. How the tree grows when it's young, it's very thin, right? Very gentle. But as the age go on, it becomes thicker, 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 gains volume, it maturates actually. The same goes with the hair. So you have the initial, that circular spiral that grows, and around this one all the time it gets thicker. So this is called the maturation. So after that point, even that small, slightly miniaturized or thin hair you may see in the front side, they will gain even more dense over time, and it will become more like a mature looking hairline.
Okay. A lot of the viewers of my videos are asking if I will be needing a second surgery. And they are referring here 2 points. First, the recently transplanted new hair. Is there a possibility that that will also fall after a while? And the second point is, will the old balding line, let's put it that way, go farther back, revealing a new balding area between the transplanted area and the old hair?
Yeah. Okay. The need for the second transplant for you, I think you don't need it. But we should not forget one point, okay, that it's an aesthetic procedure. And everyone's understanding of the handsomeness or beauty is maybe really different. Okay? That's point number one. Because when we do the surgery, most of the time, a two-step surgery or the second surgery is needed for the stage 4 to 5 of the North Hamilton or above. Okay? It differs from the size of the head, the density we aim for, okay, and overall expectation of the patient. For example, if the patient has a Norwood 5 or 6, he has an extended stage of the hair loss, okay, a two-step surgery may be a more appropriate planning for this patient. But you have the stage 4A of the North Hamilton scale. What does it mean? The loss of the continuity of the front hairline, deep recession lines at both temples, and thinning across the front side and transition zone between the front side and mid scalp. So it went a little bit into the mid scalp. So that's why it's stage 4A. But we also have the regular stage 4 North Hamilton scale when the front side is gone, and you also have an empty spot in the crown area. But you are on 4A actually. So the single step surgery with an appropriate number of the grafts would perfectly sort out all your problems. And the main question is next. Are you happy with the result? And if it satisfies you, that's perfectly well. Transplanted hair, they are very resistant to the effects of dihydrotestosterone. Most of the time, what we see in males is the phenomenon called androgenetic alopecia. It counts for around 80 to even up to 85% of the cases of the male pattern baldness. Okay, if you get the graft from safe donor zone from back of the head, the area which is where the grafts are resistant to the effects of dihydrotestosterone, they really hardly recede. But sometimes what we see, specifically in black market clinics, is that they hunt for the sky high numbers. We call that mega sessions. Okay, 5,000, 6,000 to 7,000 grafts. Okay. Of course, we can get this number as well, but to get these numbers, most of the time, you have to be out of the safe donor zone. And when you go out of the safe donor zone, the grafts or the hair follicles in this area, they are more prone to the effects of dihydrotestosterone. So, yes, you can make the patient happy saying, hey, we got from you 6,000, and he will feel very satisfied, okay? But in reality, when we transplant this hair all the time with miniaturization of the hair loss or the continued hair loss, this hair may also be gone. Okay, so that's why we do the surgery actually to cover the open areas. But it's very, very important for us to keep the pre-existing hair of the patients as well. For this reason, most of the time, we advise the patient the medical treatment. So surgery fixes the open areas, and medical treatment protects your pre-existing hair, preventing furthermore hair loss. Otherwise, your hair loss may go on, and we may end up with new empty spots across your scalp, and you need one more surgery, one more surgery, one more surgery. But your donor area is not endless. As we always say, the best surgery is not having the surgery. If you can avoid it with the medical treatment, it's always the best option for the patient.
Another question which the subscribers and the viewers of my videos are asking is regarding the hairline. Why didn't I ask you to put it farther down? And I know we've discussed this subject, but it's a very sensitive topic, and maybe you will be so kind and explain us again why in my situation you couldn't came with a new hairline a little bit lower.
Okay, in my opinion, the successful hair transplant surgery is up to 7 or 80% is with the good design of the front hairline. The front hairline, when we design the front hairline, there are many variables you have to take into consideration. Age of the patient, ethnicity, I mean the race of the patient, okay? And the height of the front head muzzle, that's also very crucial for us, because when you raise your eyebrows, you can see there's a there are like wrinkles here. That's actually a front head muzzle. So the hairline should be, most of the time, should be like a little bit above this line, because otherwise, if you get it too close to that muzzle, with every mimics you do when you talk, when you smile, your hair gonna move back and forth. We do like Chewbacca from Star Wars. It's really funny and unnatural. Okay, and the other point is the donor area. That's also one of the variables, because if the patient has a progressive type of the hair loss, okay, progressive type of the hair loss, and his donor area is not that really bright or good, and we need to use the grafts we get more efficiently, and that's why we need to get it a little bit higher, so we can concentrate the grafts more to the corners and the mid area, and give the patient more density. Because we know the next, getting your hairline roughly 1 centimeter lower may cost the patient, depending on the size of the head, of course, something between 600 to 1,000 grafts. That's too much. Okay, we don't have the luxury at the moment. And also, we have to take into consideration one point: the hairline throughout the lifespan of the males is not the same. Over the time, it recedes a little bit to the back and to the corner. So we call it actually the maturation of the hairline. Yes, it's a type of the hair loss, but like in a modern medicine, we don't call it hair loss anymore. It happens almost 2 times in the lifespan of the males, like once in the mid 20s or like early 30s, and second one is like mid 40s or early 50s. So it goes a little bit up and to the corners. When you design the hairline, you, as I told you, you also have to take into consideration the age of the patient, because there may be a guy who's in his 40s and he wants the hairline showing you the picture saying, hey, that's how I looked at my 20s, I want this back. And believe me, it will look really weird when you put the hairline of the boy who's on his of the male of the boy who's in his 20s, the male who's in his 40s. It will look really unnatural. Okay, and whenever people will see that, they'll say, hey, which prank did this hair transplant to you actually? Okay, so that's also unnatural. So important points: age, ethnicity, the height of the front head muzzle. Okay, expectations of the patients and donor area, and also geometry of the face is also important. Okay, for example, we had once a patient in the clinic who was like a Caucasian guy. He was a white guy, and his girlfriend, she was like a mixture of like Latino and Afro pattern. And he asked for the hairline of the Afro pattern, like box shaped, and we tried to convince him like, okay, hey, yes, we can do it, but it will look really weird on you. But his idea was next. Okay, hey, I love my girlfriend too much, and I want to feel myself too very close to her, and I want the hairline like the Afro pattern or the mixture of this one. We did it actually because it's an aesthetic procedure. We've worked it thousands and thousands of times, but he wanted to go through this procedure. We shouldn't forget one point: that this is an aesthetic procedure. Okay, at the end, the patient's vision or understanding of the handsomeness or the beauty may be different, and we have to respect it as well. Of course, if it's not very, very weird, okay, there can be some exceptions, but most of the time when we explain all the aspects, all the pros and cons, the patients say, hey, now I get the point, now I see the points I didn't know before, and go with our advices, because what we have is the experience, and believe me, experience worth our words. Okay.
You've mentioned here the number of available drafts in the donor area, and that brings me to another question regarding which is the maximum number of grafts which can be transplanted during one surgery, and what about people who need more than you can do in one session? Do you call the patient the second time, the second day, the next day for the second surgery, or only after a few months, or how does it work?
The maximum number of the grafts you can get from donor area of the patient is very variable. It depends on the quality of the donor area. What's the quality of the donor area? It's its size in centimeter squares, the area actually. Okay, its density, or how many grafts are there per centimeter square of the scalp. To be eligible for the hair transplant, you need to have at least 55 grafts per centimeter square. Okay? And a good donor area is when it's something between 80 and above. That's really good donor area most of the time. The thickness of the hair is also important. We call it the caliber of the hair because the volume is also very important. Okay? The type of the hair. For example, most of our patients we have here are coming from Europe and most of the time more like Northern European countries. Okay? And what we see in Northern European countries is that we call it for ourselves a triple negative. It's like fair skin, fair hair, and thin hair. It's really a really like challenging combination the patients may have. And you have to be very, very careful. Even though the donor area may look really good, you have to be careful and you have to keep in mind the more you harvest the grafts, the more is the chance that you can damage the skin. Okay, so but there is like some mathematical ratios we keep in our mind. Let's say we have 10,000 grafts at the back of the head and it's 100% of the donor area, just to make the calculation easier. How much of these grafts we can get? Roughly 50%, like around 5,000 grafts. But in a single session, you can get something between 30 to 40% of the total amount of the number of grafts. That's something around 3,000 to 4,000, if it's 10,000. And the rest, like 10 to 20%, should be done the second surgery. It's most of the time done for two purposes. First of all, when you do a high intensity extraction in single surgery, there is a higher risk that small wounds we create during the extraction can get conjoined and create really ugly scar tissue at the back of the head. That's number one. And the second point is that there is a higher risk we can compromise the vasculature underneath the skin. Okay, and that leads us for the diminished blood supply to the graft that will set the back of the head. So when fixing something, we should not, damage or like devastate something other one. So there is a ratio of around 30 to 40% of the total amount is first surgery and 10 to 20% in the second surgery. There are clinics that have different culture or like experience on how to perform the surgery. We work a little bit different, they work a little bit different. For example, some clinics, when they do different extraction type of manual extraction, they can do a 2-day surgery. Okay, in the first day they extract around 1.5 to 2,000 from one side, and the second day they do like 1.5 to 2,000 on the second half. But when we use the micromolar extraction, okay, the single day surgery is perfectly okay to extract up to 3.5 to 4,500 grafts. It depends on donor area, of course. Okay, and when we do the surgery, when all is done, the second, for example, let's say the patient has a Norwood 6. With the first surgery, we did the front side mid scalp. For the crown area, the second surgery should be done at least 6 months after the first surgery. Okay, there is very important note here. If we didn't touch the crown area during the first surgery at all, you can do this next surgery 6 months after. But if I've touched the crown area during the first surgery, there should be at least 9 to 12 months after the first surgery.
Okay, everybody asks me, I want to do a hair transplant. Is it 100% certain that I will get good results, or what are actually the percentage of a good hair transplant?
Successful surgery is when around something between 75 to up to 80% of the transplanted grafts survive. That gives us at least an outlook we have aimed for. Okay, that's very, very important. Okay, it's never 100%. It's medically pretty impossible because we know some percentage of the grafts we extract they can be really weak. Okay, and their adaptation to that new environment may be really hard and they may fail. That's why whenever we see advertisement from some clinics saying, hey, 100% guaranteed results, most probably it's a black market. You shouldn't believe it too much, okay? But something between 80, 85 up to 90% is really reasonable. One of the points that affect the success of outcome the surgery, number one, surgical technique. It should be performed really well, okay? There are points that from the clinic, and there are also the patient side. The clinic side is appropriate extraction, appropriate incisions, and implantation. Because if you even squeeze the grafts and implanting it too much, the hair follicle can become damaged, and you may see some kind of kinky hair, for example. but also the patient side. After the surgery care, does the patient have any chronic medical condition, okay, like diabetes or like some bleeding disorders or the other aspects? Any chronic disease can affect it as well. So it's not like, hey, that's what makes it successful. No, it's all together. There is a patient side and there is a clinic side, and they should both of them work together actually.
Most of the questions I've got were regarding the price. Like, why are there so many clinics with so many different prices? Can you explain us shortly why is a good clinic important and why are the prices so different?
I always, say it's like buying a car. Okay, everyone has their own budget. Okay, you can find, for example, the car for like, just to make calculation easy, for $10, but there are also cars for $50 and $100. Of course, number one, the quality of the job they do and experienced teams. The more experienced the team is, the better job they do. Okay, the more they want to earn because they spend more time. You should not forget one very important point. Most of the money you spend, you don't spend it for the building, for the cars, for the hotels. No, you pay for the time of the surgical and medical team. The more experienced they are, the better they are, the more valued they will be. Okay? But also, like medical facility, the services they provide or offer, okay? Even the medical disposables we use during the surgery, they can vary very widely. For example, you can find the sapphire microblades for €5. I don't know how they're made actually, but you can get one even for €70. You can use a special solution called the custodial to preserve the grafts, okay? Or you can just put some saline over them and just say, hey, stay a little bit like they're a little bit moisturized. That's enough for us, okay? The medical disposables, for example, during the surgery, the single-use gowns you use, they should be sterile, okay? So the more you pay the attention from A to Z, team, experienced team, disposable materials, experienced surgical teams, doctors, okay, the more it goes up. Okay, and of course there is one point. There is a really good saying in Turkish: there is no end for the cheap work. Okay, it means the next. You are not that really rich to pay for something twice. Pay a little bit more, but be in a safe zone. We are not saying, oh, we are the best. No, there are some criteria. Look, is it a real doctor or real surgical team? Ask for real pictures or like experience of the patients. Go for the social media. We are living in the era of the digital world where you can find information with absolutely everything. There are big monies inside this hair transplant industry, and here's the point: the more money there is as a pie, the more people will want to get it. Okay, and to get some buy from there, what they do, the easiest way is to decrease the price.
Okay, as I've anticipated, as my wife anticipated at the time we have been at your clinic in Istanbul, she was very interested about hair transplant for women, and we also got a few questions at our videos from women, and they mostly concern about getting the head shaved.
Okay, most of the time, the hair loss in females. What we should know, there is really major difference between males and females. When we see the males, most of the time we say, hey, it's under genetic alopecia. Most of the time it's like visible. We're very straightforward in this point as well. But women are really very complicated, even in the hair loss pattern as well. Okay, so whenever we see the females with the hair loss, first of all, we have to eliminate all other medical conditions that can cause it. For example, giving the birth, some hormone disbalances, or like some thyroid diseases. Okay, we really see that, as I told you, iron deficiency pretty much in the females. Okay, the stress, it's also a very important point. There is one more really tricky point. females, for example, that have a specific disease called the polycystic ovary syndrome that's really widely seen in females, can also cause some hair loss. You have to take into consideration all these aspects and ask, first of all, hey, let's exclude all other medical condition, and if it's nothing left, okay, yes, then it's like solely like hair loss for females. And surgery for females is one of the latest stages of this part, okay? And taking decision for surgery for females can be really hard. And shaving or not shaving the head for females, it depends specifically on the extent of their hair loss. For example, most of the time, the females may have a little bit high front head, okay, like naturally. The reduction of the front hairline, for example, we don't need to shave the whole head. We just shave the small area here where the deplantation should be done, okay, open up small window at the back of the head, and it's done almost with no shave. If there is some densification in this mid part, we can do it without shave, absolutely. But females, they have a Ludwig scale of the hair loss, like an extended stage, like stage 2 or 3, like with very extended like areas. They may need some shave because, we are doing the surgery once, let's do it the good way. But it's like 50-50, and it's like decided very individually. One of the points why we want to shave the head in females in extended like types of the hair loss is that the aftercare can be really challenging for them, because the pre-existing hair can get attached to the new transplant hair, and trying to like separate it, they just fish it out, pull it out, damage it, okay? But the small ones, it's much more easier to take care of. But with an extended type of hair loss, or like surgeries with the number of grafts, more than 3,500 grafts, it may be better to go with the shaving. But it's decided very individual. As the guy or as the doctor, as a hair transplant surgeon, that I have been doing this for more than 7 years for now. It's my 8 years already in hair transplant surgery. And I can say I'm already very experienced in this field. One of the biggest misconceptions the males may have regarding the hair transplant surgery is that, let me lose as much hair as I can, then I'm going to undergo my surgery. Okay, it's a wrong point, because, as the hair loss progresses, we should not forget that the area that needed to be transplanted gets larger as well, and we don't know how it's going to affect the donor area, how much the extent of the hair loss will affect the donor area as well. Okay, and so we may end up with the point then where there will be a mismatch of the donor and the recipient area, and we have to find a compromise, putting something here, something less, a little bit here, a little bit more here, and like putting up the puzzles and stick them into one, and then you go to the 2 or even 3-step surgeries. Is always the best, just like in any other field of the medicine. The early intervention is the best. Okay, let's fix it surgically at the early stage. The early stage means normal 2 and above. Okay, and then like treat the rest with the medical treatment to protect what you still have. It's always the best decision. Okay, and one more thing that we most of the time see from the patient is the let's say they're afraid of the local anesthesia. There are many ghost stories on the internet saying, hey, the local anesthesia hurt it really much. That is like, it hurt it was like a nightmare. Okay, there are actually 2 types of the local anesthesia in the world that are really widely used, by the way. One of them is that, there is a classic local anesthesia with the needle, and there's a like needle-free local anesthesia. Sometimes every once in a while it's like wrongly named as a painless local anesthesia, but it's a really wrong term. It's the needle-free local anesthesia is actually the high-pressure device. This is called Dermojet every once in a while. When you push the button with the high pressure, it like disperses the local anesthetic over the skin of the scalp. Okay. Yes, it works. Yes, it's good, but there are some points we don't like about this method. For example, it gives us all the superficial numbness. It doesn't really rapidly go to the lower layers of the skin. Its duration of the action is short, and it can leave like round marks across the scalp that may last for up to 3 or 4 months in some patients. Okay. The local anesthesia with the needle, it's I personally love it for a couple of reasons. For example, because not everyone's pain threshold is the same. Some patient may have a high pain threshold. Okay. So they may need less local anesthetic. Some patients may have a low pain threshold, so you need more local anesthetic. I can do perfect dose adjustments. That's very, very important for us. And with the needle, I can pass all the layers, just like a pie. Your skin is the layers, so I can pass them all in one session, giving like more coverage in a single shot. And most important, the duration of the action is longer. It covers up to 4 to 6 hours. Okay, and there is a really big misconception depending on the local anesthesia. It's not because due to the needle sticks. The needles are very tiny. The main reason why you feel the pain is that the chemical structure of the local anesthetic is a little bit, its pH is a little bit low. It's around 4.7, 4.8. Okay, so when you inject it or when you administer it and gets in touch with the tissues underneath the skin, it gives you that burning sensation. The patient experiences pain. For example, how we handle it. For example, we do the injection with the smallest gouge needles. That's number one. Number two, we can cool this area because we know the cooler you get this area with some ice, the transmission of the pain signals goes down, so it's much better handled. And what as a medication, we also add some sodium bicarbonate into the local anesthesia to make the solution of the local anesthetic its pH a little bit higher. And believe me, depending with this, all this aspect gets really low. So it can be really well handled. You just need to know how to do it.
Okay, so thank you so much, Dr. Ahmedov, for taking your time to chat with me. I hope to see you in 4 months when I'll have the 1-year anniversary, and let's hope for the best results.
With the hair shaped one, and with the candle there.
Okay, I'll make a special cake with hair and So thanks again, Dr. Ahmedov, and see you soon. So again, I was one of you 1 year ago. I was one guy with some boldness problems who had in mind maybe to do a hair transplant, and let's say more driven by curiosity. I choose to go to Istanbul to have my hair done, and I'm happy I did it at Smile Hair Clinic, which I can totally recommend. But of course, you are free to do your own research. I'm very happy if you're asking me all kind of questions, because I was, like I said, one of you 1 year ago, and I was also having a lot of questions which I asked other persons who had undergone this type of a procedure, and it was very helpful to me, and I thank them. And that's why I am open to any questions, and I'm trying to help you with an advice if I can give it to you, or with an opinion. So feel free to comment at this video and ask whatever you need to ask. So the next update will be roughly 1 year after the transplant, and another one I will make then at 18 months barrier Dr. Ahmedov mentioned. So I'm very curious if on our next meeting I will have more hair than now. But even if not, as I said, I'm very satisfied with the results so far. So see you soon, guys.